forget about me.
AIDS, or acquired immune deficiency syndrome, is caused by human immunodeficiency virus, HIV, and slows down the effectiveness of the immune system. AIDS is passed from person to person through bodily fluids. Dementia is a decline in the normal functioning of the cognitive ability in the brain. Those who have dementia experience difficulty with memory, behavior, language, judgment, and thinking.
Hello? This is Duke. He's come to read to you. Read? Mm-hmm.
All right, now, where did we leave off? Oh, yeah. It was the night of the carnival. Noah was there with his friends Finn and Sarah.
No?
That's where they met. June 6th, 1940. Allie was 17 years old.
Fell in love, didn't they?
Yes, they did.
Good. I like this kind of story. Go on. This is a good story.
I'm glad you like it.
I think I've heard it before.
Yes.
Perhaps more than once.
So I understand that you read to Miss Hamilton.
Yeah, to help her remember.
Because, dementia is irreversible. It's degenerative. After a certain point, its victims don't come back.
That's what they keep telling me.
Well, I just don't want you to get your hopes up.
Hi. I'm Allie.
Hi, I'm Mary Alice.
Mary Alice. Nice to see you.
Nice to see you. Daddy, come home. Mama doesn't know us.
The AIDS dementia complex is a neurological disorder in which a person suffering from HIV or AIDS contracts dementia because of the HIV virus.
When HIV infects a person, the virus crosses the blood-brain barrier inside monocytes from the bloodstream within 14 days of infection. Once across the barrier, these monocytes are activated and transform into macrophages. Macrophages, white cells located in the brain that act as a supply for HIV, are the virus's first target in the central nervous system. These white blood cells can carry HIV into the brain from the bloodstream. A macrophage infected by HIV in the brain can shed a particle of the HIV's outer layer, causing nerve cell damage in the brain. The macrophages release substances such as quinolinic acid and nitric acid, which in great amounts become toxic to the brain. These substances bind to the nerve cells in the brain and cause cell dysfunction or death. Research has found higher levels of these substances in people with ADC. The diagnosis of ADC is tricky and heavily depends on the sharp judgment of doctors, combined with specialists such as psychiatrists or neurology experts. The diagnosis is established on clinical grounds in the development of characteristic signs and symptoms of dementia. ADC is suspected when it becomes difficult to concentrate or maintain intellectual efforts during work, activities, and daily living. Motor abnormalities also are common, such as the slowing of eyelid movement and limb reflexes. The next test is a standard scan, either a CT computed tomography scan or a MRI magnetic resonance imaging scan. The CT scan uses special X-ray beams to produce detailed images of organs and structures within the body. If the patient has ADC, the CT scan will show signs of destroyed brain tissue. The MRI scan is a sensitive brain scan used when the CT findings are not certain. This will help reveal the presence of cerebral atrophy and may also show white matter abnormalities. The third test is a spinal tap. This procedure removes spinal fluid from the spinal canal. It is helpful in diagnosing inflammatory diseases of the central nervous system, such as ADC.
Symptoms of ADC include depression, poor concentration, forgetfulness, loss of memory, social withdrawal, short attention span, irritability, apathy, weakness, impaired judgment. A patient is most likely to acquire ADC later in the advancement of AIDS. A child is more likely to develop ADC than an adult. ADC can manifest itself in children as a progressive disease in which brain function is affected. The best therapies for ADC seem to be anti-HIV drugs and high dosages of AZT. To treat the symptoms of ADC, doctors prescribe psychoactive drugs. To wrap this up, let's talk about prevention. In order to prevent oneself from getting ADC, you can abstain from sex, be faithful to one partner, or use contraception consistently and correctly. To reduce the chance of blood transmission of HIV, use clean needles, safely dispose of the used ones. Mother-to-child transmission can be avoided by stopping the infection in women and preventing the increase of unwanted pregnancy.